Exactly. So hearing aids are a form of sound therapy. We use the candle in a dark room analogy. Often that comes from Jastroboff and TRT. But if you imagine a candle in a dark room, you can't help but notice the flame. If you turn on the lights, then the flame is just kind of mixed in with all the other everything
Background.
that's in the background
Mhm.
of your visual field, and then it's not as noticeable. And that's what hearing aids do on an auditory level. If the tinnitus is in quiet, it tends to be very prominent and noticeable. If you add some sound, which is what hearing aids do, they just amplify everything in the environment. The tinnitus tends to be less noticeable.
Hey everybody, this is Michael Piscos from MindEar, and you're listening to the Tinnitus Unplugged podcast, the show that answers all your tinnitus questions and helps guide you through your tinnitus journey. Tune in regularly to listen to a variety of world-renowned tinnitus experts share valuable tinnitus management tips and information to help you manage your tinnitus. To learn more, visit us at www.mindear.com. Welcome back to another episode of Tinnitus Unplugged, a podcast from MindEar. I'm very honored today to introduce our special guest, Dr. Jim Henry. Dr. Henry is one of the world-renowned subject matter experts when it comes to tinnitus. So we're both pleased and honored to have him here today to talk with us. Dr. Henry has recently launched a book series that contains 2 books. Book 1, the Tinnitus book, Understanding Tinnitus and How to Find Relief. And that's accompanied by book 2, the Tinnitus Retraining Therapy book, which helps walk you through TRT. And those are part of the Ears Gone Wrong series. So we're happy to have Dr. Henry here today to discuss some of that with us. And Dr. Henry, why don't you tell our listeners a little bit about yourself and your experience working in the tinnitus industry for the last number of years?
Yeah, hi. Thank you, Michael, for that nice introduction. And I'm happy to join you and talk about tinnitus, which has been my passion for about 30 years now. Just briefly, I have a daughter who's deaf, and because of that, I got interested in audiology. I went back to school and got my master's in audiology, and got hired at the VA hospital in Portland in the auditory research lab. And that's where I discovered, hey, I like research. I wanted to be a clinical audiologist, but now I wanted to be a research audiologist. So I went back to school again, went to Oregon Health and Science University, got a doctorate in behavioral neuroscience. That took 6 years, but it was worth it because it allowed me to start my own research career. Those 6 years I also spent in the lab of Jack Vernon and Mary Meikle and that group. They were tinnitus pioneers. They had the first tinnitus clinic in the world, and that was like they started that clinic about 50 years ago. So I consider the last 50 years to be the modern tinnitus era. And really, what Jack Vernon and that group did was develop what's called the masking method, which is very misunderstood, but it's basically using sound to get a sense of relief from tinnitus. They don't necessarily try to cover up the tinnitus, which is what masking would indicate. They just use sound to provide a sense of relief from tinnitus. Anyway, that got me interested in tinnitus research. So when I completed that program, I wrote a grant to do a tinnitus measurement project that was funded in 1995. And I did tinnitus research continuously until I retired in September of last year. So it's been my passion all these years. And when I retired, I decided I wanted to write these books. So now I'm spending my days mostly writing, but also giving some presentations and anything I can do to further the field of tinnitus and provide helpful information, mostly to patients who often don't know where to go and where to get good help.
Yeah. And I think, if you do get a chance to hear Dr. Henry speak live, I highly recommend you take advantage of that opportunity. Um, so on that note about working with patients and trying to help them find relief from their tinnitus, I imagine that's what your books entail. and probably go in quite great depth on how people can take those first steps to navigating through this tinnitus journey, and help guide them through the entire process. Can you share with our audience a little bit about what they could expect by reading through your books?
Yeah, the first book is sort of an overview of tinnitus, from A to Z. What do people need to know? In my mind, what do they need to know about tinnitus to make informed decisions so that when they go to an audiologist or an otolaryngologist or anybody and they have questions about tinnitus, they can be informed. And often they'll be better informed than the clinician if they have the information from this book. So basically, it covers what is tinnitus, how is it manifested, uh, how and why does it affect people? It doesn't affect everybody. Most people just kind of habituate to it. They don't pay attention to it, but it does affect about 20% of those who have it in a pretty serious way, and they really need help. And then it also covers the methods of treatment that I would consider to be credible and helpful and evidence based. And it also has a bunch of appendices with additional information. So that was book one. Book two focuses on the method called tinnitus retraining therapy, or TRT. That was developed by Dr. Jastreboff back in the really the late 80s. It was used in a clinic in London. And then he wrote a seminal article in 1990, and the method really took off in the 1990s. And most likely, tinnitus retraining therapy is the method that's used most often around the world. It's very well known, but it's also a very complex method that people have trouble understanding. Clinicians have trouble understanding, and patients have trouble understanding. So I tried to make this very understandable. I've studied TRT for many years. I've done previous books written to professionals. Now this book is written to the consumer, to try to kind of open up the black box of what
Mhm.
TRT is and what it's all about.
Yeah, that's a great summary. And as someone who's worked with TRT as well, you bring up a really good point that there's a lot of layers to it. It's complex and oftentimes difficult for many audiologists to execute properly, because of that
Yeah.
complexity. Now, in your work over the years, you've also worked with another sort of management style called progressive tinnitus management, also known as PTM. Can you share with our listeners a little bit about what that is and how that might differ than something like TRT?
Yeah, so I cut my teeth on tinnitus masking and Jack Vernon's method, and then I learned TRT in the I think in 1997 I took my TRT training. I wrote a grant on TRT. I did another grant on TRT, so we really studied it a lot. I was the clinician providing TRT directly to patients. Wrote a couple of books directed to professionals. Wrote a bunch of articles. The What I ran into was that TRT was so complex that people really had trouble understanding it. So we decided we needed to develop a method that was a little easier to understand, but also very efficient. I worked in the VA, and VA audiologists are extremely busy. They don't really have much time to provide tinnitus services. They're mainly dealing with hearing loss, and that takes up all their time. So we're trying to wedge in some tinnitus treatment along with what they're doing, and so we created this method that is considered a stepped care method, and that means starting at a low level and working up to higher levels as the patient has a need for higher levels of service. And basically, it's getting the patient to the right person to begin with, the right clinician, and then every person who has a tinnitus should have their hearing evaluated, because most likely, if they have chronic tinnitus, they also have hearing loss. And then they also often confuse their tinnitus problem with their hearing problem. So they need to with an audiologist, have their hearing evaluated, have a brief tinnitus evaluation, and then determine how much of a problem do they have with hearing, how much of a problem do they have with tinnitus, and do they also have a sound tolerance problem, which is also common, usually hyperacusis. So this audiologic evaluation is level 2, PTM level 2, And then that determines if they need higher level services, which would be PTM level 3. Level 3 is skills education. So we're taking ideas from TRT, ideas from masking, ideas from pain management, and we're using cognitive behavioral therapy, sound therapy. We're combining all of these different methods together, and we've created 5 sessions which cover all of what I just mentioned, and doing it in a very individualized manner so that patients determine what they need to help their particular situation. So that's level 3. Most patients are have their needs met in level 3. If they don't, they go on to level 4, which is called interdisciplinary evaluation. And that's a full comprehensive evaluation by both an audiologist and a psychologist. And based on that evaluation, they may have further needs. That would step them up to level 5, which is called individualized support. And at level 5, we can continue with what we did at level 3, or we can branch out into different methods. There's tinnitus activities treatment, there's TRT, there's more cognitive behavioral therapy, there's third wave CBT, which is mindfulness therapy and acceptance and commitment therapy. We can even do bimodal stimulation and some of these other more experimental, not as well evidence-based methods. That's what level 5 is. And that's more of a hand-holding level where we're working one-on-one with the patient for as long as they need services.
Yeah, I think that's again a great summary of all the different services that are out there that can be implemented to help people with tinnitus. There was a lot there, and like you said, it's not a one size fits all, right? So it's not
Yeah,
everything is going to work the same exact way for everybody. So
exactly.
being able to pull what might work best for a particular person is important, because you have the ability to pivot according to what the person's needs are, like you said. As you mentioned, you worked with the VA for a long time, and that's such a fascinating population, because hearing loss, tinnitus are so prevalent in that population. Are there differences between the populations of the veteran population versus, say, the civilian population in how you approach tinnitus and how you manage it?
That's a great question. I've been asked that before. I'd say for the most part, no. The tinnitus affects people, in very different ways, but I don't think there's any real big difference between veterans and non-veterans. So they all need this basic uh, hearing evaluation. They need to learn what their tinnitus is all about. They need to learn what they can do about it. And that's what we do in level 3 is cover all those different skills, and we try to tailor them to what their individual needs are. And I would say that's pretty much the same for veterans and non-veterans. Now, one thing about the VA is that, like I mentioned, the clinics are so busy that and they're not getting paid anything extra. VA audiologists are just paid a certain amount, period. Private practice audiologists are paid according to the services that they provide. And if they sell hearing aids,
Point
they get a profit from that.
commission.
And so they're very different clinical practice models. But I think as far as the population of patients, the needs are basically the same. I'd say there's a lot more hearing loss and a lot more tinnitus in the veteran population than there is in the non-VA population, but the needs are pretty similar.
And as you've worked over the years with people suffering from tinnitus, you talk about getting credible information, truthful information. What are some of those first steps, those common first steps you have to take with patients to get them moving in the right direction?
Yeah, one is just helping them to realize that although there is no cure, there are good services available, and a lot of people have difficulty with that right off the bat. If you can't cure my tinnitus, you can't help me. A lot of them come in with that attitude. They want some kind of a pill. They want some kind of a procedure done on them. They feel like we should have the answer for them, and we should be able to just provide it to them. And so that's a barrier right from the very beginning with many people is that they want that immediate help. And then we have to explain to them, well, there is no cure. There's laboratories around the world working on a cure, but they haven't discovered it yet. So
Right.
the best we can do is learn to manage our tinnitus. And then they may say, well, I, I can't even imagine managing my tinnitus. I can't imagine living with this for the rest of my life. Well, they're not necessarily going to live with it for the rest of their life, so we tell them that.
Yeah.
In fact, in some people, their tinnitus diminishes and it rises and falls. And, if they take care of themselves and avoid loud noise, and protect their ears, um, most likely it won't get any worse, and it might even get better. So we try to give them some positive
Sure.
counseling so that their outlook is
Yeah.
more positive. And then we let them know that there is good help available. And I personally would mention these different methods: tinnitus retraining therapy, cognitive behavioral therapy, tinnitus activities treatment, and progressive tinnitus management. I think those are the four well-established behavioral methods that I would recommend to anybody, provided they are administered by a competent clinician. And then the only other thing I'll mention is this confusion between hearing loss and tinnitus. A
Hmm.
lot of people have tinnitus and they know they have tinnitus because they can hear it, but they also have hearing loss, but they don't know they have hearing loss, but they know they have hearing difficulties.
Hmm.
So they blame their tinnitus for their hearing problems. So they think their tinnitus is a problem. They have no idea that they have a hearing loss. And so that's why, that's another reason why they need to go to an audiologist and have their hearing evaluated and parse out these issues.
Yeah.
You have tinnitus. Okay, how much of a problem is your tinnitus? You have hearing loss. Okay, what can we do to help you with your hearing loss?
Right. And for many people who do have hearing loss, using hearing aids can actually help with tinnitus, correct?
Exactly. So hearing aids are a form of sound therapy. We use the candle in a dark room analogy. Often that comes from Jastroboff and TRT. But if you imagine a candle in a dark room, you can't help but notice the flame. If you turn on the lights, then the flame is just kind of mixed in with all the other uh, I, everything
Background.
that's in the background
Mhm.
of your visual field, and then it's not as noticeable. And that's what hearing aids do on an auditory level. If the tinnitus is in quiet, it tends to be very prominent and noticeable. If you add some sound, which is what hearing aids do, they just amplify everything in the environment. The tinnitus tends to be less noticeable. So that's in general how hearing aids can be helpful for tinnitus.
Yeah. Another important reason to point out getting that auditory evaluation first step is so important.
Yeah.
You
Yep.
had mentioned some research about laboratories around the world looking for cures for tinnitus. You being in the research field for so many years, what research is being done, and are you excited about for the future?
Um, the laboratory research I try to stay on top of, but that's not really my area of expertise. But I do understand and understand it well enough to know that they've uncovered a lot of what's going on inside of the brain when a person has tinnitus, and a lot of it was unexpected when they started really studying it. And they have to study it in animals; they can't study it in humans. So they have to create these animal models that have tinnitus. And you would think, how in the world would you know if an animal has tinnitus? Well, they have ways of doing that, and they're very clever, and they have a number of different ways. So they have ways of determining how much activity is going on inside the brain, and specifically in the auditory pathways, and where there's hyperactivity, and they think that hyperactivity is associated with tinnitus. Also, the nerves tend to sync up together, and they think that's involved with tinnitus. So there's different things that they're looking at that they know, or they think they know, are related to the experience of tinnitus. So they're trying to develop drugs to regulate that activity. But not just drugs. There's also different forms of sound therapy. One is notched therapy.
Huh?
One is matched therapy. There's something called residual inhibition. So there's these different methods of applying sound to the ears that theoretically should suppress tinnitus on a long-term basis. So it's taking that hyperactivity and it's suppressing it. And if sound can do that, that would be ideal, because that would be non-invasive, non-pharmaceutical. And I really believe that systematic studies need to be done to evaluate notched sound, matched sound, and residual inhibition to see how they can make these sounds work for long-term suppression of tinnitus.
Yeah.
And then there's also this bimodal stimulation is very promising. I don't think we have proof that it works, but it's basically combining sound therapy with electrical stimulation. And there's a company right now that has FDA approval that is offering that. Now it's an expensive treatment. Uh, it may be a placebo effect. We don't know yet
Right.
because they haven't done proper sham controls.
Mhm.
But I think it's promising. There's another method coming out from the University of Michigan that's based on the same concepts. And then there's transcranial magnetic stimulation, and that's putting this magnetic coil over the head, finding the right parameters, the right positioning. That's also very promising, but they haven't quite figured it out yet. So there's
Right.
these different methods that are promising, but we need systematic studies to see if and how they work.
And it's fascinating the research that's being done to better understand the mechanisms at play, how they all come together from people who perceive tinnitus and some of the solutions that you talk about as well. But to date, it still seems like sound therapy, along with some educational component, cognitive behavioral therapy, as an example, is still really the management style of preference. Would that be fair? Because transcranial magnetic stimulation is not something available in every clinic around the country, right? That's something you probably have to find a research site in order to work with that.
Yeah, there's there's mixed feelings about transcranial magnetic stimulation. In any clinical guidelines that have been published, they recommend against using transcranial magnetic stimulation. So it's still an experimental technique, and I would say it's probably not harmful. And if somebody wanted to do it, why not? As long as there's no harmful side effects, it's worth trying. But I would never recommend people spend a lot of money on anything unless they've tried these low-level things.
Sure.
Sound therapy and basic counseling, especially cognitive behavioral therapy, is the bread and butter of tinnitus treatment right now. And sound therapy can be done in a myriad of ways. It can be used to give relief, like Jack Vernon did originally. It can be used to distract a person from tinnitus, which is what they use for pain therapy. They use distraction methods. And it can also be used as just a background sound to promote habituation, which is the TRT method. So I would just stick with those basic methods, and I think you can't go wrong, and they're going to help most people. They're not going to cure tinnitus, but I think they're going to benefit people, give them more of a quality of life.
And sound therapy is also used to help reduce stress and anxiety in some people. And stress and anxiety are also sort of symptoms of tinnitus, or could be triggers of tinnitus as well. Is that correct?
Yeah, any way you can reduce stress and anxiety, you're improving a person's tinnitus condition. And yes, they can trigger tinnitus and exacerbate tinnitus.
Yeah. So helping to reduce that overall stress and anxiety one might feel in life is something they have within their control, right? People are able to
Yeah.
to manage that themselves without any expensive products or invasive procedures, as you mentioned earlier. Um,
Yes.
you know, we talked a little bit about there not being a cure for tinnitus, and that's something in our other podcast that we make sure that people understand, so the realistic expectation is there. Um, but putting a cure aside, where do you hope? You've talked, I think, a little bit about it in terms of some of the different sound therapy approaches. Where do you hope the tinnitus management sort of industry goes over the coming years?
Well, we don't have any standards, so anyone can do anything. We don't have any credentialing programs so that anyone can claim to be a tinnitus expert. So it's the Wild West. When
Mm,
people are looking for help for tinnitus, who knows what they're going to get? So where do they go to find out, what is well established, what has been shown to work, what isn't a scam? they get on the internet, and who knows what they're going to see on the internet. And most likely they're going to be sold something if they're gullible and they don't have the information they need to make informed decisions. So I would like to see standards developed. I think that's going to be very difficult because there's these different camps. There's the TRT camp. There's different camps that believe different things, and there's a lot of different things going on in Europe that are going on in the United States. They're really more interested in tinnitus than the United States. There's relatively little research in the U.S. There's quite a bit of research going on in Europe. And I will have to acknowledge the Veterans Affairs. They have been very supportive of tinnitus research, not just mine, but other people. So there is tinnitus research going on, but not enough. And it's not really organized. It's not really systematic. Like I mentioned, these different methods of sound therapy, notch noise, match noise, residual inhibition. We need to really systematically study each one of those. We need to systematically study transcranial magnetic stimulation. We need to systematically study bimodal stimulation. So there needs to be this organized effort to determine how to go about studying these things and find out if they really work or not, because
Yeah.
we just can't say for sure.
Yeah. And I imagine these studies could help us identify subgroups of the population that might benefit from each of these particular treatments.
Exactly.
Yeah.
Yeah, we can
Yeah.
always profile people, and who does better with this treatment, does better with this treatment, and that would be very helpful if we could do
Yeah.
that.
Really tailor the treatment to the person's needs. You mentioned the difficulty of getting some standards in place with the different camps. What because there seems to be overlap between the different treatment plans. What are the main barriers keeping from kind of collectively and unifying to some standards for tinnitus?
I think the main barrier is we have professional organizations, the American Academy of Audiology, ASHA, the American Speech Language Hearing Association. I think they should get together for starters for audiologists and establish standards. Now they do have their own guidelines for tinnitus management, and that's helpful. But there's really no standards. Training in AUD programs, audiology training programs, is non-standardized. Some programs offer quite a bit of training, some offer none, others offers anything in between. Maybe they have a class or two on tinnitus
Right.
management.
Right.
So there's really, the AUD programs, I would like to see them offer some uniform training. ASHA and AAA, I would like to see them get together and recommend how audiologists should be trained in tinnitus management. And there needs to be a credentialing program, some kind of training that establishes a knowledge base, but then something that establishes a competency. And how do you do that? There are ways of doing that virtually,
Well,
where you can have a clinician get the basic training online, pass tests to establish that they have a certain knowledge base, and then they would record themselves with patients, and those recordings would go back to an expert who would evaluate how they're doing with their patients and score them. You're doing this well, you're doing this well, you're doing this not so well, and then get them to the point where their competency is verified by
mhm.
an expert. And so there could be a program to do all of that, and then that would ensure that there would be a level of standardization across all, at least audiologists,
Uh-huh.
and that's what I think we really need.
Yeah, those would be great first steps to getting to that standardization as you've talked about. For our listeners, we've talked on other podcasts about the American Tinnitus Association being a good first step to potentially find a clinician in your area that might be able to help. Aside from the American Tinnitus Association, are there any other resources or websites you might recommend to people to find who these quality clinicians are when it comes to tinnitus management?
They're kind of relatively few and far between. I do have some recommendations, people I know personally that I trust and I know they're doing a good job and they have the patient's best interest in mind. I've actually listed those resources in both of my books.
Wonderful.
And I'm also going to put them on my website. I have a new website being developed and I'm going to just list them all out. So they're all there
Great.
for free. You don't have to buy
Great.
anything. And so that's what I've put together. But I know there's a lot of other people out there that do good work. There is that list at the end of the Tinnitus Today journal that's published by American Tinnitus Association, the ATA. And I would recommend anyone be a member of the ATA, if for no other reason than to get their journal 3 times a year. The journal is packed with good information. I think it's $50 a year to be a member. You can also get telephone services by a qualified tinnitus expert. It's minimal, but but that would be something
Yeah.
available to people. And then they have this list of people who at least claim to provide tinnitus services. And some of them have received a knowledge certificate from the American Board of Audiology. And that's listed. And there's about 100 names back there. So at least that would be a starting point to contact people, ask them what kind of services they provide. Do they provide them on a regular basis? What kind of results do they get? What specifically do they do? So I think mainly people need to be informed and they need good information, and then start with the lists that are available, which are pretty minimal at this point.
Yeah. You mentioned your website. What is the URL for that for our viewers that they can check?
Yeah, it's ears gone wrong, ears gone wrong, one word .org.
Perfect.
And
Perfect.
I have a website up, but it's being completely redone. And I'd say within a month, there will be a brand new website. And I'll try to provide as many resources as possible and also make myself available to people. I'm even putting my phone number on there and my email address so people can contact me directly.
That'll be a wonderful resource for a lot of people out there. And for our listeners, do check out those books. As Dr. Henry mentioned, there are resources listed in the book that you could take advantage of. As we finish up here, Dr. Henry, you know, what for our audience, what are some of the biggest sort of myths about tinnitus that you've come across? And how do you debunk those myths for those people who are really kind of taking their first steps to do something about their tinnitus, and don't know where to turn?
Yeah, I think the biggest myth is that they go to a doctor, maybe an otolaryngologist, and the doctor says, sorry, nothing can be done. You have to learn to live with it. That's a myth. But that's what a lot of people hear, and that's negative counseling, and it can be disastrous emotionally for a person to think, I've got this sound in my head, I can't live with it, and they're telling me I have to learn to live with it. I don't know what to do. So I think the main thing is there is good help available, and it may not be available in a person's regional area, but there are people who provide services remotely. And I list those in my list of resources. So there is help available. It may need to be via the telephone or via Zoom or some other video conference, but there is help available, and they just need to find out where it is and how to access it and take advantage of it.
That's great advice to provide optimism, because you're absolutely right. There's many doctors out there who just aren't versed in tinnitus and tinnitus management, that they take the approach of that there's nothing that you can do about it, which is really just an old school mentality that needs to be updated. So
Yeah.
for our listeners out there taking their first step, know, as Dr. Henry pointed out, that there are professionals out there who can help. We've listed a number of resources today. Again, we highly recommend you check out the Years Gone Wrong book series that Dr. Henry has just released, as there's lots of good information and resources for you to take advantage of. And in addition, to check out his website once it is fully operational. So wonderful. We want to thank you, Dr. Henry. This has been wonderful. This has been enlightening. Hopefully, for our listeners, you've learned some new things today, and have a couple new resources that you can utilize and take those next steps in your tinnitus journey. With that said, Dr. Henry, want to thank you for your time. We look forward to having you again on our podcast series, Tinnitus Unplugged by MindEar. And with that, any last words you want to say to
No,
our
just I
audience?
appreciate the opportunity to speak to your audience, it's been a pleasure. Thank you.
Always a pleasure, Dr. Henry. Look forward to chatting next time.